Let's talk about chemo brain. If you or a loved one has had cancer treatment, then chances are you've heard about chemo brain. This is really described as problems with memory, focus, attention span, and a lot of patients will also describe trouble remembering names or dates or even why they walked into a room. There's also difficulty with concentration, and you may say, well, this is me every day and I haven't had chemotherapy, but imagine multiplying this times 10, and that's what chemo brain feels like. While we don't know exactly why it happens, we know it is multifactorial. It can be related to the treatment that a patient received. So some chemotherapies actually cause issues with the neurons that fire and send signals to the brain. It can be related to inflammation from treatment, and also some hormonal changes, especially in breast and gynecologic cancers. Indirect factors that should be considered are fatigue, like lack of sleep, anxiety, depression, side effects from other medications that patients are taking for symptoms related to treatment. This is very real, so you're not alone if you feel like you have chemo brain. It's a real finding. It's been documented. There are changes on brain imaging that have been seen, and there are studies that have shown slowed cognitive functioning after chemotherapy. Our governing bodies like the NCCN and ASCO both list chemo brain and cognitive impairment in their survivorship guidelines and recommend that physicians screen for this and offer supportive care. For many patients, chemo brain will last about 6 to 12 months, but for some patients, it lasts much longer than this. Low-level symptoms can persist for even years, so it's something that you should always mention to your physician if you're having trouble with chemo brain. The bottom line here is that chemo brain is not in your head, it's not emotional, it's a real side effect with biologic underpinnings. It doesn't mean permanent brain damage. Most people will find a way to adapt and regain clarity, and there are ways to intervene and help support patients who are experiencing chemo brain. So if you have any tips for patients and other survivors who have chemo brain, please list below and we'll go into it in another video in more detail.